Community awareness and engagement is another key component of the model. It's really important that we engage with our communities to better understand their needs, as well as promoting Headspace's brand and platform. Nikki, what have you learned about your community through the process of a community and engagement plan, and how has that affected the running of your centre?
Yeah, look, I think our community is very diverse. They have a strong voice, and it's really important to get out and about and show our presence within the community. I think what we've found is with the Headspace model, it's quite flexible, so we can adapt to what the community's needs are. We have a significant and active Aboriginal community with elders and young people and service providers. And what we've found is sometimes when we have increased demand for service, it can be quite difficult engaging young Aboriginal people. So I think when it comes to our community, we really need to listen to what they're saying and respond. So a lot of it is around action and increasing access and engagement of young people who may not necessarily access mainstream services. So in regards to our community, we've really looked at streamlining the referral processes and I guess fast tracking and prioritising more vulnerable groups to ensure that nobody is falling between the gaps and they're accessing a service that's timely.
Look, I think having a community awareness engagement plan is really important. We've come at it through looking at local demographic data and also data of who is coming in to use and access services at the centre through Happy and Tableau, and we knew that our local group of young people accessing our service, we had quite high rates, sort of 25% of young people who identified as not straight. We also knew from talking to older LGBTI people, some of whom worked at the centre, that the town really had very little to offer in terms of LGBTI support. Yeah. So we worked quite closely to establish a group that's now gone on to become Albany Gay and Lesbian, and specifically within that a support group for 12 to 25-year-old young people who identify as not straight or who support people who are not straight. So actually filling a definite need outside of just services at the centre, but to offer some social support and a sense of cohesiveness and that really important thing about community, that sense of belonging.
I guess for a metropolitan centre it could be quite different from Albany. I guess we have connections with other youth services. We have 41 high schools in the eastern Sydney area, interagency meetings, connections with the police, etc. And I guess through our community engagement plan, we've had to look at what are the gaps, what are the gaps for the young people, what are the gaps for the families, and I guess that's where we come in terms of really identifying what the need is. So when we first opened, we did a bit of a scattergun approach. We wanted to work with all the schools, we wanted to go into all the interagencies, we wanted to kind of participate with all the other youth services, and I guess the second year we kind of refined that because it was becoming quite overwhelming. And so what we decided to do, the majority of our young people who were really finding it difficult were coming from the state-based education schools, high schools, and the TAFE. So the second year of operation, we had a really big focus on working with the 9 state-based schools, which had great outcomes, doing some workshops with them, doing some more regular interventions with them, even just at school assemblies. And I guess our engagement plan really informed what the gaps were. And I guess for us, the continuation of getting Headspace out and the reputation out into the community, that's worked really well. Focusing on the schools that needed that additional support around mental health stigma, and just ongoing liaison with other demographics, LGBTQI, young men, the COLD community, and Aboriginal and Torres Strait Island community.
What success have you had in engaging with local media to promote mental health help seeking and your centre?
Look, our local media have been really good. I think there's been a couple of little bonuses. Our centre's straight across the road from the ABC studios, which doesn't hurt, and I also used to work at the ABC. So I guess what that is actually about is relationships. So it's thinking about media angles. It's thinking about what's the human story in this. So I guess as a centre manager, if I want to tell a story about a new service or a new campaign that we're about to offer, I'll go into that thinking about, is there someone a young person or a family who have used this service that are happy to tell their story, or happy to tell aspects of their story about how it worked for them, to really, I guess, bring it home to what it means for the person listening to the radio or reading the paper. So yeah, we certainly have used local media quite a bit to promote new services and to promote success stories as well. I think often that's a really important part of the role, sort of advocating for mental wellness and positive mental health, is to celebrate successes and where services have made a difference, because often mental health stories in the media don't necessarily do that.
Yeah.
I guess the job for the centre manager to promote the Headspace service in your area. So for me, starting out after the centre opened, was really wanting to connect with local media, so the radio stations, the local papers, and really trying to sell the service. And I guess it changes as the service develops and grows post implementation. And now, for me, it's about being purposeful, and what events are we doing that would catch the eye of the community and provide them with a story where, let's say, a parent may be reading an article and they go, that's going to be a brilliant service for my son, my daughter, etc. Reducing the stigma. So I think it can be really powerful. I think it can come with challenges as well in terms of funding, some kind of communication through local magazines, etc. That's something that you don't really have a grasp of initially, and then you get smacked with an invoice for $500 or more. But I think you have to be strategic in terms of the messages that you want to be carrying out, and have it so young people and their families, or in the community, professionals, can go, this is what Headspace do, this is where they're based, this is what they can do, and the possibilities that could come out of it. And maybe some good stories as well, so outcomes from the previous year or the previous 6 months, and having those messages so it's not too frightening for young people or the families to access the service.
And Nikki, have you had any experiences with the local media?
Yeah, I have had challenges with local media, and I guess as a new manager to the centre, I wasn't as familiar with media experience and language and all of that. So I guess we had a bit of a challenge in our centre where there was a risk to our reputation through the media getting hold of information about one of our staff members' activities outside of the centre. So I really learnt to, I guess, navigate our way through that using the lead agency to support us and having those courageous conversations with staff, I guess. So I think a lot of learning. I definitely agree that there are lots of opportunities and positive experiences of using media, but I think you still need to kind of be cautious and have a look at whether or not you can link into some media training.
And online presence is really important in today's digital age. What sort of information do you include on your website and various social medias? And what have you found works and maybe doesn't work so well?
Social media and the website, I think, are two different components. I think social media, Facebook, Instagram, speaks to different various groups and various young people. And I guess our community engagement officer primarily, along with the youth reference group, kind of manage that and coordinate that. They kind of direct what should go on, what needs to go on, when it should go on. So the frequency of take-home messages, new research, what's happening at the clinic, the centre, and really tries to promote different clinical services that the Headspace Centre is operating. Now, in terms of the web page, I would say it's really good for young people who are quite anxious about accessing support to be navigated to the web page. more so because for Headspace Bondi we have a centre tour. That's really good for kind of reducing anxiety for people coming in for the first time. If you hear mental health, you go to speak to a stranger. It's really good for parents or teachers or anyone else that can navigate that system, that website with a young person. And I guess for us, it's about promoting who works at the centre and what's operating from the centre and why. So making things purposeful and making sure that when young people or families or anyone else who are accessing the centre can understand what is the centre for, who's it to provide a service to, and what are the aims of the service. So I guess in my mind as centre manager and overseeing kind of the media and communication is it's got to be purposeful and it's got to hopefully enhance young person's engagement.
Like James said, I think it in our centre, it's our social media is managed by our community awareness officer, and she's an absolute gun. But I think as a centre manager, you want to make sure that you're still keeping a bit of an eye on what's going on, because our youth reference group also have input into our social media presence. But it gets really tricky now with, I think, so much in the way of social media happening in the corporate space, and what can be, and sort of an innocent like. If you don't delve a bit further and see what it is you're actually liking, you might find yourself in a situation where you're aligning with brands or with things where maybe the underlying message is not what you want Headspace, where you want Headspace to be. We had some quite support from a local fitness centre, who then went on to use some really inappropriate language around women, and so you have to be really careful around what a like means.
Yeah.
But I continue to be surprised and amazed by things like feel-good messages or pictures you might put out there that have this amazing response and are shared, and so play with it and try lots of different things rather than, because you never necessarily know what resonates with the community out there and can get your message into places that you never would have if you tried to.
James, how has your centre participated in national campaigns?
We've been very fortunate to have had National Office ask us to host one of the campaigns. So we had Father's Campaign last year, where we had Nathan Hindmarsh coming to the centre and promoting the importance of fathers' participation in the care of their young people. And I guess for us, it was an opportunity to promote Headspace Bondi Junction in the local community. We're, again, relatively new centre. And also to get the message out to the community that it's okay to be involved as a father. What Andrew said earlier in terms of we often focus on mothers participating in young people's care. We really wanted to kind of utilise that opportunity to get the fathers involved. And I guess other days, Headspace Day, Youth Reference Group really take control of those activities. Previous years we've done breakfast, we've gone out into the streets and given people croissants and food and give them Headspace merchandise. Our centre's right next door to one of the busiest bus stops in Bondi Junction for all the young people go to schools and come back from school. So again, utilising those times at 7:30 in the morning to promote the service. So we just use those occasions to our advantage at the end of the day.
How do you and your team prepare for national campaigns and perhaps any potential demand management issues that could come with that?
Yeah, look, preparation is really important, Sophia. I do have to say that we've done quite a bit of advocacy to National Office to let us know with as much time as possible to be aware of national campaigns and what information is contained in them and what the potential is for demand management. Because if a campaign is successful, you'll have increased demand. But look, we have regular team meetings, and so part of that is to first share all the information that you have with the team. So we'll circulate that via email, discuss it as a team, have a look at the branding resources and things like that. Maybe kick around what the potential for an increase in demand might be, and see whether we've got capacity to do that. We have in the past looked at special workshops or seminars or groups around guess the dads campaign was one where we actually held a workshop for dads, expecting there to be a bit of a demand, and we didn't have a huge attendance at that, but it was certainly something that we were prepared for. As well as celebrating dads who actually are involved, because often it's seen like it's something that mums might do more often, but I think for us, looking back on that, we would have actually maybe gone to the media with local dads who might have been willing to do that, but just anticipating is the big thing.
Yeah.
I would say the same as Andrew. As long as you prepare your team in advance, look at your current stats and look at the stats maybe when a previous campaign had occurred, and then maybe with the team talk about what strategies that you can put in place. So for us, previously we utilised our consortium partners to support us with additional intake. That support, I think other centres could maybe plan for students if they've got capacity, maybe reducing some appointment times for the youth access clinicians, and they're doing some more intake or some fielding of referrals coming in. But yeah, as long as you have some planning, talk about it amongst the whole Headspace team, not just your salaried component team, your private practitioners, medical staff, in-kind support, etc. And you can only do as what you can do in terms of your capacity.
Forming partnerships with organisations in your community is important for a variety of reasons, including fundraising. What sort of benefits have you gotten out of those partnerships in your local community?
Yeah, I think we've been quite privileged to develop some organic partnerships within the community where we have had sports clubs donate money towards our youth reference group. We have had opportunities to develop consortium partnerships with local organisations who can provide a service that the Headspace model may not be able to provide. For example, intensive outreach supports or mentoring. We have been able to access research assistants, youth workers, organisations who can support us with our reconciliation action plan, with our called community strategies. So lots of opportunities for us through developing partnerships in the community.
For us, we were lucky that the local university wanted to support the centre by giving us a donation that they do activities over the course of the year, and at the end of the year they donate the local Headspace Centre with a cheque, and last year it was $26,000. The year before it was just over $20,000, and I guess for us it's that is a true partnership in terms of the centre giving up our time to go and talk to the local colleges at the university about mental health and reducing it, so impacting on that community, and then them giving it back. So we talk about what we do with the money, what do we plan to spend on it. It's spent on activities and resources as opposed to any administrative focus tasks. So for the university that give us that money, it's perfect because it goes out to local people, to local need, and for us it gives us a bit of a leeway in terms of where do we want to spend our resources and how do we want to do that for the local needs. So for us, partnerships are that's just one of many partnerships, but that's a really beautiful example of a functional, successful partnership that we've been able to create.
Our partnership with the university's been quite different. I'd love a $30,000 check. But we have a small university campus of one of the Perth universities that has medical students come down to Albany for a year as part of their university degree, and we established a partnership with them for the students to come and do a rotation through Headspace centres, so that they get some exposure to youth mental health and working with young people. And we've also now provide some education as part of their orientation to the year in Albany around working with young people and how to be youth friendly and how to have those difficult conversations. And that's a model now that has sort of rolled out across regional centres in WA where there is a Headspace centre, and one of the rural clinical school campuses. So that's been a different kind of a university partnership,
Yeah.
but one that's worked both ways in terms of future doctors getting a bit more education around being youth friendly, but also us getting some resources in terms of clinical services at the centre as well.
As a centre manager, what's your role in strengthening the connections between your centre and local organisations that connect with young people, such as schools, clubs and tertiary education?
Look, I think it's a really important role for a centre manager, this one, because you can't necessarily anticipate where those relationships are going to start. It might start through community engagement activity or a talk at a school. They also start often through friendships or someone knowing someone or going to an event and someone coming up to you afterwards. So look, I think it's really important to be opportunistic as a centre manager, to have those discussions, to sort of be out a bit in the community as well, and turning up at some of those events, or whether they're your own Headspace events or other youth relevant events, because you can very quickly give a bit of a spiel. So having a spiel prepared about what your centre does and how you engage with young people, so that people get the right idea about what you're trying to do, but are then you're able to have a bit of a discussion around what the possibilities might be there. And I think that's really important in starting new relationships as the centre manager, that you actually have a presence in those conversations. We had someone come back from a employment forum where they'd met someone from a legal firm who got talking, and the legal firm said, look, we're really interested in getting more involved in supporting young people. So that's a conversation we're sort of in the middle of having at the moment, and seeing where that might unfold. We normally think, lawyers, young people, the relationship's going to be around legal consequences for young people for stuff that they've done, but this is something completely different, and it came out of the blue.